my name is Brandy Poplin, and today I'm going to be speaking to you about the controversial topic of euthanasia. Do we have the right to die? Most of us have seen a loved one go through the dying process. We know that it can be very long, very painful, and it can be very difficult for the patients and the families to go through. Euthanasia is defined as the practice of ending a life in a manner which relieves pain and suffering. Supporters of euthanasia argue that any death that increases suffering is a wrongful death. However, opponents would argue that any deliberate death is a wrongful death. So this brings about the issue, is euthanasia a right? There are various levels and classifications of euthanasia. You may have heard many of the terms such as assisted suicide or physician-assisted suicide, and these are different topics. According to the Nightingale Alliance, physician-assisted suicide involves a medical doctor who intentionally provides a patient with the means of ending him or herself's own lives, usually by an overdose of a prescription medication. Assisted suicide involves a layperson providing the patient with the means of ending their life. Euthanasia involves the intentional and direct killing of a person by a physician, most commonly by lethal injection. The problems that arise with things such as assisted suicide is that there can be complications. Since the patient is not under a physician's care, there can be problems with side effects or the actual suicide not being successful. That is why, if a patient were to so choose to end their life to prevent a prolonged death of agony and suffering, it should be done under a physician's care. This way, it can be done with dignity and can be very peaceful for the patient and the family members. It is a hard subject to think about. I do not believe suicide is the right thing to do. However, I have seen many patients struggle in the last days, weeks, and months of their lives, and it is very difficult to watch a person go through this. If you have ever seen a person struggle for their last breath after battling COPD, if you have ever seen them suffocate right before your eyes, grasping at sheets and at the bed and at people trying to catch a breath, trying to get any last breath they can get, and literally suffocating in front of you, you may have a different opinion. If you've ever seen someone with end-stage cancer moan and cry in pain day after day, knowing there is no chance of recovery, you may have a different opinion. Euthanasia and assisted suicide are legal in some countries such as the Netherlands, Belgium, and Luxembourg. Assisted suicide is legal in the United States of Oregon, Washington, and Montana. Euthanasia is not legal in any of the 50 United States. The official policy on euthanasia from the American Medical Association is that the physician-assisted suicide is fundamentally incompatible with the physician's role as healer. It would be impossible to control and would pose serious societal risks. Many medical professionals cite the Hippocratic Oath as the reason that physician-assisted suicide and euthanasia should not be practiced. The oath states, "I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan. And similarly, I will not give a woman a pessary to cause an abortion." Many medical schools have revised this oath, such as Cornell Medical School, dropping the statement about performing abortions. Is this really any different than the statement about giving lethal drugs? Or has our society become more comfortable with offering abortion as a choice to those who seek it? Just like one day we may be more comfortable offering euthanasia as a choice, not the standard, but just giving the option to those patients who seek a peaceful and dignifying death. Thank you for your attention today, and I hope this has brought you a new perspective on the idea of euthanasia